it's Derek Carter with Donner and Associates. Today I'm at the Therapeutic route with Dr. Adrian Lopez.
Hey Derek, thank you so much for coming.
No, gracias a ti. So this Therapeutic route is a fairly new kind of clinic, mental health clinic in Vallarta.
Correct. So we opened about 2 years ago, and we are the only institution in the area that specializes in the treatment of affective disorders such as depression and anxiety.
Okay. And if someone wants to get a consultation or something, is it like psychiatrists that they would come and see here, or what? How does it work?
Very good question. Actually, one of the aspects that I would say sets us apart from any other institution is that we have a multidisciplinary team that is here to treat the person that comes to see us. So when you come here, you can see psychology, psychiatry, neuropsychology, neurology, and any other specialty that we have and that we consider necessary for the effective treatment of the person. So we not only have psychiatry, but we also have all the other specialties that I just mentioned.
Okay, so anything from if I'm feeling a little depressed, or if I have a family member that might be schizophrenic that I think, or anything to do with mental health, contact you and you can help?
Yeah, absolutely. So myself and our team is more than happy to receive any of the questions that people may have. Normally, we like to have an initial evaluation, which has no cost whatsoever. People can come here, talk to us, talk to me, talk to any other specialist, and we can evaluate the situation. And since we have so many options when it comes to treatment, we can do a combination of psychology, psychiatry. We also have transcranial magnetic stimulation. We have virtual reality evaluation for neurocognitive disorders. So we always tell people when they contact us, just make an appointment, come talk to us so that we can really understand the situation and we can design a plan that will provide an answer to all the necessities that the person may have.
When I first met you here at the clinic, there was somebody in a room with something on their head getting some sort of treatment. What exactly was that, or what's that for?
Very good. Very good observation. Well, that is the famous transcranial magnetic stimulation, which is a very effective treatment that was approved by the FDA back in the States in 2008. And that is a treatment that is very effective, as I just said, for the cases of resistant anxiety and depression treatment. So when people have tried everything else and it has failed or not provided the results that the person wanted, transcranial magnetic stimulation in conjunction with psychiatry and psychology has proven to be a very, very, very effective treatment for those very hard to treat disorders, such as a chronic depression or even anxiety that does not even allow the person to leave the house.
So I'm assuming, so science has come so far that they know where in the brain, what part of the brain is affected by depression, and you're able to somehow sense, what is it, not electrodes or anything like that, but you send something into that spot and it helps.
So in very plain terms,
please, for me.
Well, even for me, it's basically the way that it works is initially there's a EEG or a brain mapping that is done by our neurologist, and that will determine basically which area of the brain is deficient in electricity. As we know, our brain, our neurons, in order to do synapses and operate properly, they need bioenergy. So if any of the areas of the brain is deficient in that, could trigger cases of anxiety and depression. So the neurologist will do an evaluation or an EEG to determine which side of the brain is not working properly. Then there's an evaluation by psychiatry and there's an evaluation by psychology. We can determine that way which area of the brain should be stimulated and the intensity of the treatment, which is non-invasive and is basically a magnetic pulse that will tap onto the head of the person. You literally don't feel anything but a tapping. There are no side effects that are registered. In fact, the FDA has said that you have more chances of getting hit by a car when you leave the clinic than getting any side effect from the treatment. So basically, once the side of the brain that has to be stimulated is determined, then we need to determine the intensity. Normally, if we are talking about anxiety, it will be a treatment that inhibits the neurons from doing synapses, and if we are talking about depression, we are talking about a treatment that will excite rather the neurons so that they can do synapses. So in very plain terms, that's what it is.
And it's not just adults, because I saw in one of the rooms there's kind of like toys and stuff, so you deal with all ages?
Very good. Yes, we actually have, in terms of the room that you just saw, is the room that we use to work with kids. Now, there I would like to pause a little bit. So we have virtual reality evaluation, as I mentioned before, for neurocognitive disorders. That includes learning disabilities as well as deterioration because of Alzheimer's, dementia, and any other neuropsychological disorder. So in the case of kids, we have two type of treatments when it comes to transcranial magnetic or transcranial stimulation. One of them is the magnetic, where the person will have to stay put. So the person will sit in the chair, normally the TV there is on, they relax, it's very relaxing. When I had it done, I completely fell asleep. And normally they will fall asleep, but they cannot move because they place the machine that stimulates on top of the head. In the case of kids, as you were very well mentioning, Derek, we use the electrical stimulation or transcranial electrical stimulation. And what is that? That is a little helmet that is wireless, it's connected to a computer, and instead of creating a magnetic field to stimulate or polarize the neurons, that one sends a very light electrical impulse that will penetrate the cortex about 3 centimeters, but that allows the person to move around. So when we work with kids that, for example, have a learning disability, we will apply that protocol with electrical stimulation so that they can move. They're not tied up to, not tied up, that doesn't sound well, but they are not confined to the chair. They can move around, they can play, we have all the toys, and they normally work with neuropsychology and psychology to stimulate.
Okay, and this is kind of a new home that you took over and for the clinic in Lázaro Cárdenas, so just up from the stadium. If people don't know the Colonia of Lázaro Cárdenas, it's kind of beside Cinco de Diciembre. And I imagine that the costs here in Mexico are a lot less than they would be in Canada or the States for these treatments.
Absolutely. We have several patients that come here from the States and from Canada. The issue with the States, especially with transcranial magnetic stimulation, is that for any insurance to even get to the point of considering to pay for that, it has to be a last resource, meaning that somebody that suffers from chronic depression or severe anxiety, they have to go or undergo or suffer years of treatments that will not yield rather any kind of results, or at least not the results that the person is expecting, before the insurance will even consider to pay for that. In terms of prices, we have had patients in the case of the US that have told us that in Texas they range about $30,000 to $34,000 for the 30 sessions, which is the protocol that is approved by the FDA. In our case, it is a fraction of the cost. It's not even 10% for the entire treatment.
Wow. All right. So people are more aware of their mental health and trying to kind of find ways to deal with mental health in society and for themselves, and people are always trying to work on themselves.
Yes.
So if that's you, check out the Therapeutic route. I'll post all their information here and come for a free consultation with Dr. Adrian or one of the other physicians here. See?
Absolutely, we will be more than happy to answer all the questions, and we're here to provide an answer to whatever necessity the patients may have.
Okay, they can go to Therapeutic Route PV.
No, it's therapeuticroute.com,
Okay.
or they can reach out to my personal cell phone, which is the one that I normally carry around, which is 322-274-2729.
And I'll post that all up in the link. Gracias.
Thank you, Derek. Thank you so much.
Be well and be healthy.